Yeah, right, do you want to come this way? Thanks.
It is now possible for pregnant women with a history of a previous pregnancy
affected with either Patau syndrome, Edwards syndrome or Down syndrome
to be offered non-invasive prenatal testing, or NIPT, from 10 weeks gestation through the NHS.
I can see you're about 10 weeks pregnant and it's your second baby?
That's right, yeah.
Lovely. Tell me about your first baby.
Doing really, really well, yeah, at school. I can't believe how time's flown.
And I can see from your notes that she has Down syndrome?
That's right, yes.
Yeah, so tell me when that was picked up. Was that antenatal or did you find out after she was born?
After she was born.
Okay. So just wanted a bit of a chat with you today really about what you thought about screening or any testing in pregnancy, if any at all.
Pregnant women are already offered NIPT after a high chance routine screening result. But having a previously affected pregnancy now puts the patient into that high chance category to begin with. A change to the National Genomic Test Directory means that screening midwives in England can request NIPT for this group of patients without the needs to have serum screening first. The test directory is where health professionals can find details of any genomic testing that can be offered to their patients.
NIPT is a form of non-invasive prenatal screening. It's possible because of the presence of cell-free DNA or cfDNA. This is present in the plasma of every individual and is a natural product of the breakdown of cells and tissues. When a person is pregnant, one of these tissues is the placenta. The placenta releases cell-free fetal DNA or cfDNA, and it's this material that allows us to perform non-invasive prenatal testing or screening to inform pregnancy management.
It's really important to confirm the previous trisomy condition. You can do this by looking at previous pregnancy records. You can access paediatric records if the diagnosis was made postnatally, and you can even contact the genetics lab if you need to. A small percentage of trisomy conditions are due to an unbalanced translocation. This is usually when a parent is a carrier of a balanced chromosome translocation.
The presence of a translocation will be clearly mentioned in a report, and these reports will look a lot more complex than those you're used to seeing for a standard trisomy 13, 18 or 21 report. Translocations can mean a much higher chance of a trisomy condition in the pregnancy. It's therefore very important that these individuals are referred to their local clinical genetics department so they can receive appropriate genetic counselling.
Also, a small number of trisomy conditions are reported in mosaic form. This is where not all of the individual cells have the chromosome difference. The chance of a mosaic trisomy happening again in a future pregnancy is very low. We could offer you non-invasive prenatal testing, so that would be just a blood test but a more accurate blood test. So the way that it works is when the placenta embeds into the uterus, the placenta releases free cell DNA, so we're looking for placental DNA in effect, so it's about 99% accurate, and it would tell us whether you had a higher chance or a lower chance of having a baby with Downs, Edwards or Pataus. Of course, NIPT is a choice. People who have had previous pregnancies with a trisomy condition can have NIPT, or they can choose no testing at all. They can have the routine first trimester screening, or they can have an invasive diagnostic test.
The non-invasive test, that's just a simple blood test, is it?
Literally just a blood test. So not invasive, no risk to the pregnancy.
Ordering NIPT for patients with previously affected pregnancies will be similar to how you do it already for your high chance patients. The sample will need to go to the same lab you already send these samples to, and you will need to use the same request process, but make it clear that there is a history of a previously affected pregnancy. The request form has a distinct category for this, with the specific R number from the test directory.
In order for us to perform NIPT analysis, we need you to provide us a 10 ml venous blood sample. This tube must be stored at room temperature and we must receive it within 5 days. In order to ensure there's enough cell-free DNA in the sample, it is important that it is taken after 10 weeks gestation, as confirmed by scan. If we detect a higher than expected level of chromosome 13, 18 or 21 in the plasma, this can suggest the presence of a trisomic condition in the baby, and we would issue a high chance result. The report wording and format will look much like NIPT results you may have received before. As long as the test hasn't failed, there is no need to offer any routine serum screening unless your local policy indicates otherwise.